Hello and namaste friends. Today we are going to discuss about the fetal circulation. In fetal circulation, we will discuss the fetal circulation in three important topics. First, we will know about what is the normal fetal circulation. Then we will discuss about what are the changes that occurs in the fetal circulation after birth, and lastly we will discuss about the postnatal derivatives. So let us start step by step. Initially, the blood from the fetus is carried to the placenta for oxygenation through an umbilical arteries. In fetus, we have two umbilical arteries. These umbilical arteries are the branches of the internal iliac arteries, which is the branch of the aorta. Once the blood reaches to the placenta through an umbilical artery, oxygenation takes place in the placenta. Through the placenta, the oxygenated blood goes back to the fetus through an umbilical vein. In fetus, we have only one umbilical vein. The right umbilical vein degenerates and the left umbilical vein is left. This umbilical vein carries oxygenated blood from the placenta to the fetus. Once the blood reaches the umbilical vein, it goes to the liver. Here only small amount of blood goes to the liver sinusoids, and majority of the blood bypass the liver through a special channel called as ductus venosus. This channel bypasses the blood going to the liver and drains into the inferior vena cava. This is our inferior vena cava. From inferior vena cava, the blood drains into the right atrium. In between the right atrium and the left atrium, there is an opening called as foramen ovale. Majority of the blood passes from the right atrium to the left atrium through this foramen ovale. Some amount of the blood that is coming from the superior vena cava and inferior vena cava goes to the right ventricle by the right atrium. Once the blood reaches small amount of blood reaches the right ventricle, it drains into the pulmonary trunk. In pulmonary trunk, we can see that in between the left pulmonary artery and the aorta, there is a connection called as ductus arteriosus. This ductus arteriosus moves the blood from the pulmonary artery to the aorta. The main reason is that the blood that is going to the pulmonary artery cannot go to the lungs, because the lungs in the fetus are not developed initially and not expanded, so that oxygenation does not take place. And also the pulmonary artery is of high resistance. This is the reason why the blood from the pulmonary trunk is shunted to the aorta through the ductus arteriosus. This becomes about this we have talk about how the blood from the right ventricle goes to the aorta by the ductus arteriosus. Initially, we have talked about the majority of the blood from the right atrium goes to the left atrium through a foramen ovale. Now the blood from the left atrium goes to the left ventricle, and from the left ventricle the blood goes to the aorta. From the aorta, it supplies to the different organ of our body, and finally after going the blood to the aorta, majority of the blood from the aorta is again taken back by the umbilical arteries for oxygenation. This is how our fetal circulation cycle takes place. In this normal fetal circulation, we have to know about some of the important points. Firstly, there are two umbilical arteries and one umbilical vein. This may be asked as a MCQ, how many umbilical veins are there, or how many umbilical arteries are there in an umbilical cord. So there are two umbilical arteries and only one umbilical vein. Secondly, we should know about the two channels that bypass the blood. Firstly is our ductus venosus, which bypass the liver and drains the blood from the umbilical vein to the inferior vena cava. Secondly, we have another channel called as ductus arteriosus, which shunt the blood from the pulmonary trunk to the aorta. This we have talked about how the normal fetal circulation takes place. Now the main topic of our discussion is what are the changes that occurs in the fetal circulation after birth. So we are going to discuss about what are the changes that occurs in the fetal circulation after the birth. Initially, the fetal lungs are not developed. Once the placenta is cut off after the birth, the blood supply from the placenta is shut down, so the right atrium pressure decreases. On the other hand, when the baby first cries, the lung expands and the blood from the right atrium goes to the right ventricle, and on expanding the lung, also there is one major thing that happens in the pulmonary trunk is that the resistance in the pulmonary trunk decreases. Initially, we have seen that in the pulmonary artery there is a more increase in resistance, but once the lung is expanded, the resistance in the pulmonary trunk is decreased. Now the blood after oxygenation returns back to the left atrium through a pulmonary vein, and then it goes to the left ventricle. From the left ventricle, it is again pumped into the aorta. And now we should know about this channel, ductus arteriosus. What happens to the ductus arteriosus after the birth? Our ductus arteriosus is mainly sensitive to three things. What are those three things we are going to discuss about? Firstly, it is sensitive to first things that is sensitive is to oxygen. When the blood is passing through the aorta, it contains the high oxygen amount as it is oxygenated in the lungs, and the cells of the ductus arteriosus is sensitive to the oxygen, which leads the smooth muscle of the ductus arteriosus to constrict. Second things that the ductus arteriosus is sensitive to is bradykinin. This bradykinin is released when the lung expands. When the lung expands, it secretes a bradykinin, and the bradykinin acts on the smooth muscle cells of the ductus arteriosus, that leads to the constriction of the ductus arteriosus. Initially, before the birth, the cells of the ductus arteriosus is secreting the prostaglandin. That is prostaglandin E1 and E2. This prostaglandin keeps the ductus arteriosus open, but once the lung is expanded and the oxygenated blood is coming to the left heart, then this prostaglandin levels decreases, and these all three things helps to keep the closure of the ductus arteriosus. And now we are going to discuss that there was one opening called as foramen ovale. What happens to the foramen ovale after the, but once the umbilical cord is cut off, the pressure in the right atrium decreases as the less blood comes, as there is no chance of blood coming to the right atrium through the placenta, and more amount of blood is coming to the left atrium through the pulmonary vein after the oxygenation, and the pressure in the left atrium increases while the pressure in the right atrium decreases. This increase in the pressure of the left atrium closes the foramen ovale. These are the changes that occurs in the fetal circulation after the birth. Now we are going to revise once more. We should keep in the mind that initially the fetal lung is not expanded and the oxygenation is not taking place, but once the birth is taken place, after the first cry of the baby, the fetal lung is expanded and the blood is going to the lungs for the oxygenation through the pulmonary system, and from the pulmonary system the oxygenated blood is coming to the left atrium, and through the left atrium it goes to the left ventricle and then to the aorta. And we have discussed about the three things that how the ductus arteriosus become closer after the birth. Firstly, the ductus arteriosus is sensitive to the three things we have discussed. That number one, we have discussed about the oxygen. In the presence of the oxygen, the cells of the ductus arteriosus constrict. That helps in the closure of the ductus arteriosus. Secondly, we have talked about the bradykinin. Bradykinin is released once the lung is expanded. This also helps to constrict the ductus arteriosus by acting on the smooth muscle. Thirdly, we have discussed about that initially the prostaglandin was secreted by the cells of the ductus arteriosus, which keeps the ductus arteriosus open, and once the oxygenated blood goes to the aorta and it is shunted, the prostaglandin level is decreased, and this also helps in closure of the ductus arteriosus. And after the cut of the umbilical cord, the pressure in the right atrium decreases and the blood, more blood comes to the left atrium. That's why the pressure in the left atrium is increases. This helps in the closure of the foramen ovale. These are the things that we have discussed till now. Now we are going to discuss about what are the postnatal derivatives of discuss what happens to the umbilical arteries after the birth. These umbilical arteries will change into the medial umbilical ligament. The postnatal derivative of umbilical arteries is medial umbilical ligament, and the postnatal derivative of the umbilical vein is ligamentum teres hepatis. Similarly, the postnatal derivative of ductus venosus is ligamentum venosum, and the postnatal derivative of the ductus arteriosus is ligamentum arteriosum. This postnatal derivative is often asked as an MCQ in the exam, and also the foramen ovale. The postnatal derivative of the foramen ovale is fossa ovalis. This postnatal derivative should be kept in mind. The postnatal derivative of foramen ovale is fossa ovalis. Ductus arteriosum will change into the ligamentum arteriosum. Similarly, ductus venosus is changed into the ligamentum venosum. Umbilical vein is changed into the ligamentum teres hepatis, and the umbilical arteries is changed into the medial umbilical ligament. This is about the fetal circulation. In shortly, we are going to recap the fetal circulation once more. Firstly, the blood from the fetus is carried to the placenta for oxygenation by the umbilical arteries. There are two umbilical arteries that carries the blood to the placenta for the oxygenation. After the oxygenation, the blood goes to the fetus back by the umbilical vein, and it bypasses the liver through a channel called as ductus venosus. From the ductus venosus, the blood goes to the inferior vena cava and drains into the right atrium. Majority of the blood goes to the left atrium through an opening called as foramen ovale. A small amount of the blood from the right atrium goes to the right ventricle and drains into the pulmonary system. From the pulmonary system, the blood is shunted to the aorta through the ductus arteriosus. The main reason of the shunting is that because the lung is not developed and the pulmonary system is of high resistance, this helps in shunting of the blood from the pulmonary artery to the aorta. Then from the aorta, the blood again goes back to the placenta for oxygenation through an umbilical arteries. We are going to discuss about the what are the changes that occurs after the birth. We have after the birth, the ductus arteriosus closes, and the ductus arteriosus is sensitive to three things. Number one, oxygen. Number two, bradykinin. These two helps to keep the acts on the cells of the ductus arteriosus smooth muscle to constrict. Secondly, in the presence of the oxygenated blood, the prostaglandin levels decreases. These all three things will help in keeping the closure of the ductus arteriosus. Similarly, lastly, we are going to recap about what are the postnatal derivatives. The postnatal derivatives of umbilical arteries is median umbilical ligament. Similarly, the postnatal derivatives of umbilical vein is ligamentum teres hepatis, and the postnatal derivatives of ductus venosus is ligamentum venosum. Similarly, the postnatal derivative of ductus arteriosus is ligamentum arteriosum, and the postnatal derivative of the foramen ovale is fossa ovalis. This we have talked about the fetal circulation. Hope you like the video. If you have any confusion, you can ask in the comment section. If you like the video, then like, comment and subscribe the channel. Thank you.